Bismillahirrahmanirrahim. Assalamu alaikum. This is Varda Batul from Imamia Medics International Women's Wing. I welcome our audience who are joining us from different parts of the world to today's webinar, which is being presented by Women's Wing Florida chapter. As we are all aware that the month of March is associated with the observance of Women's Day, but this year, the Women's Day is different from all the previous years, especially because of the injustice going on all around the world. And that includes especially the massacre of the innocent young girls of Menab, of a school in Menab, Iran. We at Imamia Medics International Women's Wing strongly condemn the oppression and we stand with those who are oppressed. Here, we also would like to appreciate all the work which is being done by the Women's Wing members in support of all those who are oppressed. And we aim to continue to work for the betterment, for the health and well-being and education of women all around the world. Now, I'd like to introduce our moderator for today's webinar, that is Sister Noor Shirazi. Sister Noor Shirazi is a third-year medical student at Nova Southeastern University College of Osteopathic Medicine in Dave, Florida. She earned her undergrad degree from the University of Florida, where she majored in microbiology and pursued minors in international relations and French language and literature. Her academic background reflects a strong interest in both the scientific and socio-cultural dimensions of healthcare. Noor has recently contributed to published research and remains actively engaged in ongoing projects focused on chronic diseases. She is particularly passionate about preventive medicine and patient education with a long term goal of improving health outcomes through community based initiatives. Her interest in public health has been shaped by her experience working in rural communities abroad, where she gained insight into global health disparities global health disparities in the rural communities abroad. She has also partnered with peers to organize community workshops aimed at promoting disease prevention and health literacy. Outside of medicine, Noor enjoys reading, painting, journaling, traveling, and spending time with family and friends. She is deeply committed to service and looks forward to making a meaningful impact as both a future physician and a community advocate. I welcome you, Sister Noor, and over to you.
Thank you so much for your kind words, Sister Warda. Assalamu alaikum warahmatullahi wabarakatuh, everyone. I hope you're all doing well. And on behalf of Imamia Medics International, I'd like to warmly welcome you to today's women's webinar focused on dental health and education. I encourage you all to share this link with your family and friends, and hopefully we all learn something from this webinar today. As women, many of us take on the responsibility of taking care of family, friends, everybody around us, which means that understanding dental health doesn't just benefit us personally, but also allows us to better guide those around us, whether that's children, siblings, or parents. Today's session is especially exciting because we have the opportunity to learn from an expert who will help break down the common misconceptions, share practical tips, and empower us with knowledge we can apply in our everyday lives. Whether it's preventative care, recognizing early signs of dental issues, or understanding when to seek treatment, this is a conversation that truly does impact us all. So inshallah, by the end of the session, you'll walk away feeling more confident about your oral health and be better equipped to make decisions for yourself and your loved ones. I encourage the audience to comment your questions down below and we'll address them later in the session. Before we truly get into it, beginning any gathering by remembering Imam Mahdi Ajlallahu Ta'ala Farajak and the Ahlul Bayt alayhim salam grounds our intentions in something higher than ourselves. It reminds us that knowledge, service, and even our professional pursuits are ultimately acts of worship when they are aligned with their teachings and values. So in invoking them, we seek barakah, guidance, and sincerity so that what we say and do benefits not only ourselves, but our communities, inshallah. It also connects us to a legacy of compassion, justice, and excellence, inspiring us to carry those qualities into every space we enter. So, with that, I'd like to introduce Sakina Rizvi, who will be reciting Dua Faraj for us today, inshallah. Sister Sakina is a 16-year-old high school student in 11th grade who represents curiosity, creativity, and the drive we hope to see in the next generation. She has a love for baking and cooking, not just as hobbies, but as ways to explore nutrition, health, and creativity. She also enjoys journaling and photography, both interests that reflect her thoughtful nature and her ability to observe the world with intention. Sakina is constantly learning, trying new things, and developing the skills that will help her make a positive impact in the future. Young women like Sakina remind us that growth starts with curiosity and that the future belongs to those who are willing to learn. So, with that, I welcome Sister Sakina.
Thank you so much for the warm introduction. I will now be reading Dua Faraj. Bismillahirrahmanirrahim. Allahumma kun li waliyikal Hujjat ibn al-Hasan. Salawatuka alayhi wa ala abaih. في هذه الساعة وفي كل ساعة وليا وحافظا وقائدا وناصرا ودليلا وعينا حتى تسكنه أرزك طوعا وتمتيه فيها طويلا برحمتك يا أرحم الراحمين. Thank you.
Thank you so much for that wonderful recitation, Sister Sakina. Again, I invite you all to put your questions in the comments section as we move along, and we will do our best to answer them towards the end of the seminar. The next, we're going to move right into it, and the next person I'd like to introduce is our speaker, Dr. Sabah Rizvi. Dr. Sabah Rizvi has been practicing dentistry for over 28 years. Throughout her career, she has developed a deep understanding of her patients, their concerns, and their treatment needs, helping many individuals overcome dental anxiety and regain confidence in their oral health. She firmly believes that being a compassionate listener combined with a gentle touch creates an exceptional dental experience. Her mission is to provide dental care that recognizes the important connection between oral health and the whole body wellness. Through patient education and positive reinforcement, she strives to empower patients to take an active role in their health. As part of her commitment to excellence, Dr. Rizvi is a lifelong learner who constantly advances her knowledge to better serve her patients and community. She is a graduate of Rutgers University School of Dental Medicine. Seeing lives change through healthier smiles, improved function, and relief from pain brings her deep professional fulfillment. On a personal note, Dr. Rizvi is married to Hassan Rizvi, a patent attorney. She is a proud mother of 5 children and a wonderful son-in-law. In her free time, she enjoys fitness, sketching, traveling, reading, and continuing to explore her passion for health and wellness. So with that, I introduce Dr. Sabah Rizvi.
Thank you so much, Sister Noor, for such a warm welcome. Assalamu alaikum, everyone. Thank you for being here today. And today I want to talk about something that most people don't realize. I'm going to share my screen. Your mouth may be one of the biggest factors affecting your overall health. Not just cavities, not just teeth, your sleep, your breathing, your energy, even your hormones. A healthy mouth supports a healthy body and a healthy mind. Let me start with a very common story. Meet Amina. Amina is a busy mom of 3 children. Her days are filled with errands, cooking, cleaning, picking, and dropping off her children to school. She tries to take good care of her health, but by the end of the day, she's exhausted, and the last thing on her mind is to brush her teeth. She looks at the mirror and says to herself, "I'm too tired to brush, and at least my smile looks good." The schedule continues indefinitely, but slowly she begins to notice some changes. Many women put themselves last. This is a very common story. The hidden changes. Amina begins to experiencing some fatigue, poor sleep, headaches, jaw tension, sugar cravings, heart palpitations. And she thought it was stress, but her body was trying to tell her something. Symptoms are often signals, but not the random problems. How many people have woken up tired even after sleeping? That is not normal. Eventually, more problems started appearing. The hidden link. Your mouth is connected to your body. Over time, Amina developed bleeding gums, inflammation, and chronic fatigue. She never realized her mouth could be affecting her entire body. The mouth is not separate from the body. It is the entrance into the body. One of the biggest hidden causes we see are sleep problems. Many women believe fatigue is normal, but the real cause is poor breathing during sleep. Snoring, dry mouth, grinding, headaches, brain fog, and waking tired. Who here has woken up with dry mouth when they've woken up? That is often a breathing problem. So sleep starts with proper breathing. And breathing starts with something very simple. The mouth is for eating and the nose is for breathing. Nose breathing improves oxygen. It gives you better sleep. It builds stronger immunity. Mouth breathing causes a dry mouth, increases the risk for cavities, gum disease, and poor sleep. How many of you have children who sleep with their mouths open? That can affect facial development. And dentists often see these problems first. As you can see from the diagram, a person who breathes through their nose, their facial structures look significantly different than somebody who breathes through their mouth. We have a receding chin. They have a forward posture. Their eyes are looking tired. Their jaw is set back and they have a very narrow face. Dentists often see early signs of sleep disorders before a medical diagnosis. We see grinding of the teeth, narrower arches, tongue restrictions, inflamed gums, and jaw tension. Your mouth often shows disease before the rest of the body. And another hidden factor is bacteria. The mouth contains billions of bacteria. Some are helpful, others cause inflammation. Harmful bacteria are linked to heart disease, diabetes, Alzheimer's, stroke, and pregnancy complications. This is an inflammation problem.
many ways, your mouth is the gatekeeper between the outside world and the rest of your body. Your mouth is teeming with billions of bacteria. There are more bacteria in your mouth right now than there are people on Earth. Over time, these bacteria can stick together and multiply. They form a colony, and the colonies can then join together, forming a thick layer called a plaque biofilm. This can eventually spread across every surface of your entire mouth, your teeth, your gums, your cheeks, and your tongue. Every small space in your mouth provides the perfect environment for bacteria to thrive and for the plaque biofilm to grow, which it can do dramatically over the course of a single day. Your mouth's inflammatory cells are activated to kill the bacteria, but the bacteria can build strong defenses within the colony to stay alive. These inflammatory cells, which are designed to protect the body, can then cause harm in the form of gum inflammation, also known as gingivitis, the earlier stage of gum disease. People with diabetes are even more susceptible to gum disease because their blood vessels are compromised. The area between your teeth and gums is densely packed with intricate blood vessels. Normal, everyday activities can burst those tiny vessels. Then pieces of the plaque biofilm and bacteria can detach and mix with the blood, giving bacteria from the surface of your mouth full access to the rest of your body. And for people with severe gum disease, new science suggests that these bacteria may link to other disorders, like heart disease, where bacteria may be involved in plaque buildup in the blood vessels, or pneumonia, where bacteria can create an infection in your lungs, or rheumatoid arthritis, a debilitating disease of inflammation in the joints, or preterm low birth weight in infants, which may be linked to bacteria passed from the mother to her fetus. Good oral care may positively affect your overall health, which is important because what happens in your mouth may not stay in your mouth.
So inflammation, as you can see from the video, there's a lot of inflammation that exists in the mouth, and that could be the real problem and contribution to a lot of the things that many of us may be feeling. So, inflammation, chronic inflammation contributes to fatigue, autoimmune disease, heart disease, diabetes, hormone imbalance, and gum disease is a chronic inflammation. So reducing oral inflammation improves your overall health. Another major factor that could be contributing to your overall health and the mouth bacteria is the food. The food feeds your mouth bacteria, and frequency matters more than the amount. So for example, constant snacking feeds the harmful bacteria. You have sugary drinks, you have sticky, sweet foods, processed foods. And really we should be focused on, if you do have a sweet tooth, have it once and don't just have it throughout the day, because throughout the day, you're feeding the bacteria what it needs to thrive and grow. And sipping soda all day. If you need to have a soda, just sip it at one sitting and that's it, and then move on. So focus on, obviously, proteins, healthy fats, fibers, and water. Water is a very important factor to helping reduce inflammation. So I wanted to talk about your oral health. We just finished our holy month of Ramadan. But of course, we need to continue this throughout the year. Some helpful habits are to brush after iftar, drink water at suhoor, avoid sweets before sleep. Flossing is an absolute must, and then cleaning your tongue. Islam encourages cleanliness and balance. The other thing that I wanted to talk about was your oral health affects pregnancy. So healthy gums support a healthy pregnancy. There's a lot of research that links gum disease to premature birth, low birth weight babies, and gestational diabetes. So a healthy mouth supports a healthy baby. And as mothers, we will do whatever it takes to give that health to our babies. Another thing that I would like to talk about is, women, we talk about beauty, but your face, your mouth can also affect your face. There are many facial changes that can occur from a dental issue. So grinding, excessive amounts of grinding causes wrinkles. If one has tooth loss, that causes facial collapse, meaning the bottom third of our face starts to collapse and it looks smaller than the rest of the face. Inflammation that's within our mouth and within our body also accelerates aging. And I spoke about earlier about mouth breathing that also affects our facial development. So a healthy mouth supports your natural beauty. I just put this diagram for the 20s, 30s, 40s and 50s, and then 60s. And there are a lot of things that take place throughout the years. And it's not just, we call it age, but there's a lot of things like such as bruxism, which is grinding, tooth loss, mouth breathing, and then of course, poor sleep. If anybody wants me to share these slides, I'd be more than happy to. So basically, you can't pour from an empty cup. Women care for everyone else. It is in our nature, but we must care for ourselves first. Our health is a gift from Allah. So take care of your health so you can take care of others. You can start with just 3 changes. You can select just 3 changes, whatever those 3 changes you want to make. But, brushing twice a day is an absolute must. The most important time to brush is just before you sleep. A lot of times people skip or forget to floss. I hear that all day in the office. So flossing is one way to prevent cavities and tooth loss. And basically, if you want to keep all your teeth, flossing is part of your daily routine. Drinking more water, I really want to stress this a lot. You're supposed to be drinking about half of your body weight in ounces. So for example, if somebody is 120 pounds, 60 ounces would be your minimum requirement to be drinking that amount of water. I feel that our body doesn't get flushed enough of the toxins that are originating from our mouth in order for the body to be cleansed out. And we drink a lot of coffee these days, a lot of tea, and every cup of coffee, you should be drinking 2 cups of water after. The other thing is breathing through your nose. Absolutely, very, very important to get the richest part of the oxygen. When you breathe through your nose, the blood is more oxygenated rather than when you're breathing through your mouth. And then, of course, just reducing unhealthy snacking. So small changes create big, big results. So after small changes, Amna felt more energy. She made a few minor changes to her diet, her home care, and exercise routine, and she felt a burst of energy. Her heart palpitations disappeared, and the best news of all is she found out that she was pregnant. And so she was so happy, alhamdulillah. So, what is the real message for today? Your mouth is not separate from your body. The way you breathe affects your sleep. The way you sleep affects your energy. And the way you eat affects inflammation. So the way you care for your teeth affects your overall health. So small daily habits create long life health. Health is not just about avoiding disease. It's all prevention. And it is about honoring the body that Allah has trusted you to. Your body has a right over you, as a saying by Prophet Muhammad sallallahu alaihi wasallam. And that is it. If I would be more than happy to answer any questions. I wanted to thank IMI for giving me the opportunity to speak a few words about oral health, dental health, and hopefully I enlightened some minds. We can start the question answer session. I'll stop sharing my screen.
Thank you so much, Dr. Rizvi. That was really enlightening, and hopefully everybody has learned something about oral health that, that they didn't know before. And the body really just is all connected to each other. So to interpret one part as separate from all the rest definitely doesn't work, and your presentation really emphasized that. So next, I want to introduce the moderator of the Q&A session, Dr. Alina Rizvi. And so the questions that the audience has submitted to the comment section will be addressed during this Q&A session as well. So Dr. Alina Rizvi is a dentist practicing in Plantation, Florida, alongside Dr. Sabah Rizvi. She's graduated also from Rutgers School of Dental Medicine in 2024 and recently completed her general practice residency at Yale Hospital, where she advanced her clinical skills and commitment to comprehensive patient care. She is known for her compassionate approach and her passion for helping patients understand the connection between oral health and overall wellness. Outside of dentistry, Alina enjoys reading, baking, spending time at the beach, exploring new coffee shops, and staying active through fitness. Her balance of professional dedication and personal wellness reflects her belief in living a healthy, well-rounded life. So with that, I welcome Dr. Alina Rizvi to lead our Q&A session with Dr. Sabah Rizvi.
Assalamu alaikum, everyone. Thank you so much, Noor, for the kind introduction. So this leads us to the next portion of our seminar today, where we're going to do our Q&A session. We have a couple of questions already coming into the chat. So I'm going to go ahead and start with the first one, which is, what are the most important daily oral hygiene habits that you should prioritize to maintain healthy teeth and gums? And so I'll go ahead and answer this one myself first. So like Dr. Sabah Rizvi was saying throughout her presentation, is there's so many things that you can do at home to help prevent dental emergencies from occurring. And those things start with just brushing twice a day for 2 minutes daily. You want to be flossing at least once a day, cleaning your tongue regularly, using mouthwash, drinking plenty of water, and then of course going to your dentist every 6 months to ensure that no dental problems go missed. The second question that we have is, what are some common myths about oral health and what is the truth? So one of the most common things that I see as a practicing dentist is that a lot of time patients don't come to the dentist because they say, well, nothing hurts, so why should I come in? And this happens very often where patients, they're scared of the dentist, they don't come in for a very long time, sometimes like 2, 3, 4 years go by, and they haven't been to the dentist, and then all of a sudden they're in a lot of pain and they come in an emergency. So a lot of people think that if nothing hurts, nothing is wrong. But the thing is with dental problems is they often are completely painless. Like cavities can start, very early cavities don't cause any pain. They start breaking down the outer layer of the teeth. They're inside the inner layer of the teeth. And sometimes they can even go into the nerve of the tooth and you still do not have any pain. So oftentimes when patients come and they're coming in pain, that's when it's almost too late to save the tooth and we end up having to remove teeth, which is not what we want as dentists. We want everyone to keep their teeth and maintain all of their teeth for a healthy smile long term. So most important thing is to just come into your dentist regularly so that we can make sure none of these problems happen.
I wanted to just add to that. Another myth is bleeding gums is normal. And I've heard that throughout the years. And actually, that is not true because bleeding is a sign of inflammation, is a sign of infection. If bleeding happened in anywhere else in your body, such as under your nail beds or anywhere, then we would be very concerned and make an appointment with a doctor or physician. But for some reason, bleeding gums has been a just missed conception. And so I would say that nobody should have bleeding gums if you're properly taking care of them, meaning that we have to be brushing, the bare minimum, you have to be flossing. And like Dr. Lena said, going to the dentist at least twice a year for your checkup and x-rays and cleaning.
Okay, thank you so much. And the next question that we have is, how do you prevent staining and maintain a bright white smile? So this goes along with the first question, just daily oral health habits that you can have at home. Most important thing to prevent staining, brushing twice a day, using mouthwash, but then also I know a lot of us drink a lot of coffee and chai and tea, and those actually contain a lot of staining agents in them. So one of the most important things that you can do, I'm not going to tell everyone to cut out coffee and tea because not everyone's going to do that, but things that you can do to avoid the staining is you can drink your coffee through a straw, obviously not hot coffee. And then also what you can do is after you do drink coffee or tea, you can immediately rinse with water. You also want to drink your coffee and tea in a small, shorter time frame. So don't be drinking it or sipping on it for about an hour. Try and drink it and then rinse with water like within 5 or 10 minutes. And then the next question is, how can I avoid bad breath? So, Dr. Rizvi, if you want to answer this question?
Yeah, I can certainly answer that question. That again goes back to, your proper brushing, flossing, which we've already talked about. But one thing that we haven't spoken about is actually brushing your tongue, tongue scraping. And believe it or not, a lot of bacteria sits over your tongue, and that creates a lot of film. And if we start tongue scraping, that really it makes a huge difference. The other thing is that, I would, if after you're doing all of that and you still have bad breath, you should definitely get tested, by a physician, make sure that there's no diabetes because there's buildup of ketone bodies in the body, and that releases a very bad odor in the mouth. So that I just wanted to make sure that you are, not just looking at your mouth, but everything holistically as well.
Okay, thank you. And that leads us to the next question. Are mouthwashes recommended for oral hygiene? Now, the answer is yes, mouthwashes are recommended. It's a good addition to your oral health routine alongside brushing and flossing. Mouthwash does not replace flossing, however. And the other thing to be careful of with mouthwashes is that a lot of them are alcohol-based, which tends to dry out the gums significantly, and that can also sometimes worsen dry mouth and cavities and bad breath. So it's important that if you are using a mouthwash, use a very natural one that is alcohol-free, and it can definitely help. The next question is, can you please elaborate on the causes of mouth breathing? So,
Sure.
Dr. You want to
Yes,
answer that?
I can definitely answer that. So mouth breathing, there are many different causes for mouth breathing. Sometimes children have enlarged tonsils and adenoids that restrict the airway from allowing enough oxygen to pass. So by default, these children just open up their mouth, and because it's a physical obstruction and the body needs oxygen, right? So the quickest way to get the largest amount of oxygen is through the mouth. That's the biggest way. And that's why these children have chronic ear infections, because the oxygen is richer through the mouth. There's something called nitric oxide that gets activated when you breathe through the nose. And there are these filters in the nose that help trap the bacteria, the fungus, the parasites, the viruses before it enters into your body. But when one breathes through their mouth, that filtration process is gone, and those children end up giving a lot of inflammation, not just in their mouths, of course, in the mouths, because the tonsils are also trying to help trap a lot of the bacteria, but they can only do so much. And then what literally the tonsils start actually almost touching each other, and they're like choking, and so that's why they just start to open up, and they have like this forward posture, trying to get that airway positioned in the right way so they can get more oxygen.
Okay, and then there's another question that goes right along with this question as well, and how to be more mindful that we are breathing from the nose if someone notices that they are mouth breathing.
Yeah, so it is a developed intentional habit. Sometimes when I ask my patients, do you breathe through your nose or breathe through your mouth? They actually have to think about it because they haven't thought about it. So knowledge, that's number one, knowing that you should be breathing through your nose, that's the key element right now. If we wake up in the morning and your mouth is dry, right? Then you know that you have been breathing through your mouth, right? You have to grab a sip of water as soon as you wake up. Another thing that once maybe somebody can let them know, it could be their either their spouse or their parent, and seeing if they are actually opening, checking in on them. Are they breathing through their nose? So somebody can tell them if they are breathing through their mouth. There is ways to help the child. The number one thing is the tongue should be up on your palate. That is the resting position for the tongue. That allows for the airway to open up because you're moving that muscle and you're moving it forward. So just being mindful and exercising that tongue to keep it up against the palate behind your two front teeth, and then closing the mouth. And then at night, a lot of times I do suggest lip taping. They can place medical tape and they can put it vertical, and they can actually be very intentional about keeping their mouth and lips closed. So a combination of developing those muscles and being very, very intentional about that. I hope that answers that question. Wait. Are you muted? I think you're muted.
Oh, thank you so much. So the next question is there a difference between flossing with a thread versus interdental brush? So I can go ahead and answer this. There's a very big difference between actually flossing with traditional dental floss, which is a string, and then there's something called an interdental brush, which is a little brush that comes on like a little pick, and that often people can use to clean in between the teeth. But the interdental brush only really works for patients who have very large gaps between the teeth, otherwise the brush won't fit. So the best way to remove bacteria and buildup between the teeth is using traditional floss. Even the string floss is better than the little floss picks because those you only clean up and down, but with the traditional floss, you can clean around the teeth and around the teeth behind it. So the number one best floss is just the traditional string floss. The next question is there an age bracket where getting braces is more effective?
I can answer that. So according to the American Dental Association, it is best to bring your child in between the ages of 7 and 9 for an evaluation with an orthodontist or a general dentist to see whether that is the perfect time to start the braces or wait until the teeth are all out and they start when the permanent teeth are in. So it depends case by case. I can just speak from my own experience with two of my children. With Dr. Lena, we did two phases where we started the braces early on, put expanders in, and then once that phase was done, then we put the traditional braces. My other daughter, she went straight to just braces, and then just straightened her teeth that way. So it really depends, but 7 to 9 is the best time.
Yes, definitely. Another question that we have here is, Are there any diseases that start in the oral region and can affect or spread in the whole body? So like Dr. Rizvi was saying before, there are so many different systemic diseases are linked from the oral health to the rest of the body, and a lot of them play a direct role with each other. For example, diabetes and periodontal disease have almost a direct link, and with so many other things as well. And Dr. Rizvi, you can expand a little bit more.
Yeah, so the mouth is huge with the connection with the rest of our body. Like I spoke in my speech, inflammation, a lot of inflammation that is built up from the bacteria can lodge into our bloodstream and create a blockage in our heart or in our brain, leading to strokes and heart attacks. That's like the two main things. Your brain is the closest organ to the mouth. Your heart is the next closest thing to your mouth. So those things I highly recommend, to make sure that everything is very, very clean. Now, the other thing I spoke about is for women, I'm not sure a lot of women realize it, but when you're pregnant, your mouth is directly related to the health of your baby and the rest of your pregnancy. So definitely I encourage, regular teeth cleanings throughout the pregnancy to help relieve some of the bacteria that's in the mouth. There's plenty of other conditions that are connected to the rest of our body, but I'm hoping that I answered a few of those.
Yes, thank you. Another question that we have here is, we hear a lot about fluoride in water and toothpaste have carcinogens effects on the body. Is that true?
That's a very controversial question, but I will answer that. So fluoride, back when it was approved to be placed in our water systems and in our products, in small amounts, if used with the right judgment, does prevent cavities. But just like everything, in life, everything with moderation. If a child swallows a whole tube of toothpaste with fluoride, it is very toxic. And so when patients ask me whether their child should get fluoride and they're concerned about it, we have a lot of other methods to help prevent cavities now. And if they feel that they don't want to have fluoride, I respect their wishes, and we don't use it on those patients. But it is mainly a philosophy of how we want to care for our patients, and in very, very small doses, it is fine. But there are trends that people are moving away from fluoride.
Yes, thank you so much. I just wanted to add as well, a lot of the times people are concerned about fluoride in drinking water, but there's so many different studies that show that as long as it's not over 0.7 milligrams per liter, it is safe to have fluoride in the water over a whole lifetime. And in any of those cities and states where there is fluoride in the water, we notice that there's a huge reduction in cavities in both kids and adults, and there's no strong evidence yet that it caused any systemic health problems at these levels. So a lot of the misconceptions have come from where there's excessive fluoride or children eating fluoride just like by the tubeful and all of that, which can of course cause toxic problems when it's in excess. So the next question is about sleep apnea. Does sleep apnea affect dental health?
Yes. So sleep apnea has a big, big factor over your dental health. For starting with the child, there are children who do suffer from sleep apnea, and those, because the tongue posture has not been established, they are not pushing their tongue up against their upper palate. So the upper palate is like the scaffolding of your teeth, and if the upper palate is narrow or underdeveloped, then you have crooked teeth. And the crooked teeth on the upper causes your bottom jaw to be underdeveloped. And so your bottom jaw is more recessed back because it can't move forward because it hasn't been developed. So those are some of the issues that sleep apnea is showing up in the dental field, but then that leads into your overall health. When somebody has sleep apnea, obviously the oxygen, which is very vital for all of the cells and organs to function, but the gateway is your mouth. So that's why we focus a lot on examining the mouth and testing to see whether they are a sleep and apnea patient.
Thank you. We're getting such amazing questions. We are on our last question now. So the question is, how often should someone visit the dentist for scaling and cleaning, and what are the recommendations? So I can start off by answering this that recommendation is at the minimum is to visit the dentist every 6 months for a cleaning. Now, this is very dependent per patient. This is something that insurance has decided that they will cover 2 cleanings a year. But every person's mouth is very different. For example, if you are a patient that has gum disease, then oftentimes dentists would recommend a quicker recall schedule for you. For example, every 3 months or every 4 months, depending on how quickly your body and your mouth builds up tartar, calculus, and plaque. Sometimes if you have very healthy gums, healthy teeth, and very good home care, every 6 months is plenty for you. So it's very case dependent.
Yes, that's perfectly answered. Obviously, it depends on person to person. I would say for all of our scaling and root planing patients, we do have them on a every 3 to 4 month regimen that they're coming in for their maintenance visits. Because once it's kind of like it's a condition, it's like diabetes, right? You're treating it, you're managing the symptoms. And so we have to make sure that the patients who have gum disease, because of the bone loss, they are going to be accumulating a lot more plaque and tartar. And so we have to get into underneath the gum line to help clean up all the bacteria more often than somebody who has like very healthy gums, very tight gums, they have very good bone support. So your case would be, treated, handled very differently.
Yes, thank you so much. So I believe that was the last question. These were such amazing questions, and if there's nothing else, then I will hand it back over to Noor.
Thank you all so much. That was an amazing, informative session. Thank you to the audience for submitting such wonderful questions. It helped make this webinar all that more informative. And so we're going to move right along here, but thank you to Dr. Seba Rizvi and Dr. Alina Rizvi for such comprehensive answers as well. So as we come to a close here, just one more speaker. I'd like to introduce Mrs. Scummer Nukvi, the chair of the IMI Women's Wing Florida chapter. Her passion for service and commitment to uplifting women in medicine and the community truly embodies the mission of Imamia Medics International. And so we thank her for her leadership and her commitment to organizing this webinar. It's helped foster a space for learning, collaboration, meaningful impact, and I'm confident that everybody who is participant to or audience to this webinar is definitely taking something great away from here today. So with that, I welcome Mrs. Scummer.
Walaikum Assalam, Noor, and everybody. I just want to thank you, everyone, for the wonderful webinar. Dr. Sabah Rizvi, Dr. Alina, Dr. Noor, all the IMI Women's Wing, Dr. Varda, Dr. Nazleen, Dr. Huma Naqvi, and especially our leader, our president, Zahra Naqvi, and everybody for coming today and participating, and our wonderful Ashur Zaidi. उनके बगैर तो हमारी कोई चीज़ complete नहीं होती. So with that, I would like to thank everyone, and I just want everybody to take a minute and do a Surah Fatiha for all the shuhada and what's happening in the world. अल्लाह सबको अपने हिफ्ज़ अमान में रखे और मोहम्मद वाले मोहम्मद के सदक़े में। तो इंशाल्लाह let's do a Surah Fatiha and over to Dr. Warda. Thank you everyone. Thanks again. Khuda Hafiz.
Jazakallah. Jazakallah, Qamar Aunty. We'll be reciting Surah Fatiha and then we'll be wrapping up. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين صدق الله العلي العظيم. Inshallah, we'll see everyone with another healthcare awareness webinar next month with Imamia Medics International Women's Wing. Thank you everyone for joining us today. Take care. Allah Hafiz.